Hello and welcome back to another Soton Brain Hub video. I'm Benjamin, and in this video we'll discuss the common anatomical locations for berry aneurysms, which are small sac-like bulges in the walls of blood vessels in the brain. These can be problematic since they can expand and push on nearby structures, and they make the vessel wall more prone to bleeding, which can lead to a hemorrhagic stroke. Let's first recap some relevant bits of anatomy. The Circle of Willis is an arterial ring that sits at the base of the brain, at which the anterior and posterior brain circulatory systems anastomose, or join together. The anterior circulation is derived from the anterior and middle cerebral arteries, which arise from the internal carotid artery. These major vessels are bridged by the anterior and posterior communicating arteries. The posterior circulation goes back to supply the posterior brain and brainstem, and is made from the vertebral arteries, which combine to form the basilar artery, which then splits into the two posterior cerebral arteries. The design of this structure is such that areas that fork or branch experience greater force than straight channels, and it's in these areas that aneurysms are liable to develop. The Circle of Willis is covered in more depth in another video by my excellent colleague Dr. Charlie. Let's first look at the brain's anterior circulation system. The most common site for the formation of berry aneurysms is within the anterior communicating artery, which connects the two anterior cerebral arteries together in the midline. These account for just over a third of all cases of berry aneurysm. This commonly comes up in med school MCQ examinations, so is worth remembering. The internal carotid artery is the second most common site for aneurysms to form, with just under a third of cases occurring here. The third most common place for aneurysms to form is along the middle cerebral artery, which is the largest branch of the internal carotid artery and supplies blood to the lateral surface of the brain, which include parts of the frontal, parietal and temporal lobes, like the primary motor and somatosensory cortical areas of the face, trunk and upper limbs, and the optic radiations. Special mention here to the posterior communicating artery, since though uncommon, if we develop a berry aneurysm in this location, it can press on the oculomotor nerve, which will carry on through the supraorbital fissure and innervate the majority of our intrinsic eye muscles that move the eyeball around. So if a patient develops a sudden thunderclap headache alongside reduced eye movements, think posterior communicating artery aneurysm. Berry aneurysms can also occur in the posterior circulation, most commonly at the top of the basilar artery, at the junction of the basilar and superior or anterior inferior cerebellar arteries, and the junction of the vertebral artery and the posterior inferior cerebellar artery. Aneurysms in the posterior circulation have an 8 to 14 times greater risk of rupturing than anterior circulation ones. Remember though that this is relative risk, and the absolute risk is still small, since the rate of small anterior aneurysm rupture is around 0.05%. Med school examiners love to test the fact that these aneurysms can be classically linked to two types of medical condition, namely connective tissue disorders such as Ehlers-Danlos, which is a disorder of collagen synthesis in which the integrity of arterial walls alongside other structures are compromised, and also the cyst-forming condition, autosomal dominant polycystic kidney disease, where the polycystin mutation means that people with this inherited condition are much more likely to form these aneurysmal abnormalities. Thank you for watching. Do consider subscribing to the channel as we continue to explore the mysteries of the human brain.